Today we'll discuss the uterus. In layman's language, the uterus is called the womb, also called hystera, on which the word hysterectomy is based. Uterus is a childbearing organ in the female situated in the pelvis between the bladder and the rectum. Although it is hollow, it is thick-walled and firm and can be palpated bimanually during a pervaginal examination. It is the organ that is protecting and providing nourishment to a fertilized ovum, enabling it to grow into a fully formed fetus. At the time of childbirth or parturition, contraction of the muscles in the wall of the organ result in expulsion of the fetus from the uterus. Coming to the size and the shape, the uterus is piriform in shape. It is about 7.5 centimeter long, 5 centimeter broad, and 2.5 centimeter thick, weighing 30 to 40 grams. It is divisible into an upper part, expanded part called the body, and the lower cylindrical part called the cervix. The junction of these two parts is marked by a circular constriction called the isthmus. Here. So this can you see the piriform shape of the uterus? Okay. So this is the fundus of the uterus over here. This part is called the cervix, right? Now, the part of the uterus above the opening of the fallopian tube. These are the opening of the uterine or the fallopian tubes. The part of the uterus above that is called the fundus. Now, the body is forming the upper two-thirds of the organ and the cervix forms the lower one-third. The uterine tube, the ligament of the ovary, and the round ligament are attached to it on either sides. The superolateral angle of the body projects outwards at the junction of the body and the fundus, and it is called the cornua of the uterus. The normal position and angulation of the uterus. Normally, the long axis of the uterus forms an angle of about 90 degrees with the axis of the vagina, and this angle is open forwards. The forward tilting of the uterus relative to the vagina is called anteversion. The backward tilting of the uterus relative to the vagina is called retroversion. The uterus is also slightly flexed at the level of the internal os of the cervix, and that is referred to as anteflexion, right? So you can see over here, this is the angle of anteversion between the long axis of the vagina and the axis of the cervix over here. This that is about 90 degree. This is the angle of anteflexion between the long axis of the uterine body and the axis of the cervix. Now, the angle of anteflexion, as you can see over here, between the axis of the uterine body and the axis of the cervix is 125 degrees. Roughly, the long axis of the uterus corresponds to the axis of the pelvic inlet, and the axis of the vagina to the axis of the pelvic cavity and of the pelvic outlet. Now, it is normally deviated to the right side and also called dextrorotation. So, the uterus is anteflexed, anteverted, and dextrorotated. Communications. Superiorly, the uterus communicates on either sides with the uterine tube and inferiorly with the vagina. Now, the parts of the uterus. The uterus comprises of a fundus, a body with two surfaces, anterior or the vesical surface related to the bladder, posterior or the intestinal surface. It has two lateral borders and a cervix. Now, the fundus is formed by the free end of the uterus lying above the openings of the uterine tube. It is convex and shaped like a dome, covered with peritoneum and directed forward when the bladder is emptied. The fertilized oocyte is usually implanted in the posterior wall of the fundus or upper part of the uterus. The anterior or the vesical surface of the body is flat and related to the urinary bladder, as you can see in the picture. It is covered by peritoneum and forms the posterior or the superior wall of the utrovesical pouch. Utrovesical pouch between the uterus and the bladder. This is your utrovesical pouch, the blue arrow. Right. Now, the posterior or the intestinal surface is convex and is related to the coils of the terminal ileum and to the sigmoid colon. It is also covered with peritoneum and forms the anterior wall of the rectouterine pouch. Okay, behind the rectum, rectouterine, this is the pouch. The curved blue arrow is the rectouterine pouch. Each lateral border is rounded and convex. It provides attachment to the broad ligament of the uterus, which is connecting it to the lateral pelvic wall. The uterine tube opens into the uterus at the upper end of this border. The end of this lateral border gives attachment to the round ligament of the uterus, antero-inferior to the uterine tube, and to the ligament of ovary. The uterine artery ascends along the lateral border of the uterus between the two layers of the broad ligament. In the sagittal section, as you can see in this picture, the cavity of the body of the uterus is seen as a mere slit because the uterus is compressed anterior posteriorly, while in the coronal section, the cavity is seen to be triangular in shape, the apex being directed downwards. At the apex, the cavity becomes continuous with the canal of the cervix. This junction is called the internal os. The superolateral angles of the cavity receive the openings of the right and the left uterine tubes. Now, coming to the cervix is the lower cylindrical part of the uterus, less mobile than the body, about 2.5 centimeter long and is slightly wider in the middle than at the either ends. The lower part of the cervix projects into the anterior wall of the vagina, dividing it into a supravaginal part and a vaginal part. The supravaginal part of the cervix is related anteriorly to the bladder, posteriorly to the rectouterine pouch containing coils of intestine and to the rectum. On each side to the ureter and is embedded in the parametrium. The fibrofatty tissue between the two layers of the broad ligament and below it is called the parametrium, and it is most abundant near the cervix and the vagina. Now, the vaginal part of the cervix projects into the anterior wall of the vagina. The space between it and the vaginal wall is called the vaginal fornices. The cervical canal opens into the vagina by an opening called the external os. Right. So you can see over here, this is the external os of the uterus. This is the vaginal part, cervix of the uterus. This is the cervical canal over here. In a nulliparous woman, that is a woman who has not borne children, the external os is small and circular. However, in multiparous women, the external os is bounded by anterior and posterior lips, both of which are in contact with the posterior wall of the vagina. The cervical canal, this is the cervical canal, is fusiform in shape, as you can see, communicates above with the cavity of the uterus through the internal os, this is the internal os, and below with the vaginal cavity through the external os. Now, this canal is flattened from before backwards so that it comes to have an anterior and posterior wall. These walls show mucosal folds which resemble the branches of a tree called the arbor vitae uteri. The folds in the anterior and the posterior walls interlock with each other and close the canal.